Hey guys, I'm Melissa, and today I'm going to be talking about toxic shock syndrome, or TSS, and the bacterium that causes it. So, the bacterium that is most commonly associated with toxic shock syndrome is Staphylococcus aureus. And Staphylococcus aureus is a gram-positive cocci, which we can see right over here. And because Staphylococcus aureus has the ability to ferment mannitol, it then produces an acid which changes the indicator color from red to yellow, which we see over here. We can see the little colonies, and we can also see the yellow. And it is also coagulase positive, which means it has the ability to clot blood plasma, and it is the most virulent out of the genus Staphylococci. Some of the most common symptoms of TSS acquired from Staphylococcus aureus include a fever, muscle aches, vomiting and diarrhea, redness of the eye, mouth, and throat, and the sunburn-like rash that later peels. And over here in this picture, we can see that sunburn-like rash. We see the redness, the dryness, the crackiness, and we can even see some of the peeling of the skin that's going on. Hypotension, shock, multi-organ failure, and death can also occur. As for transmission, the bacterium Staphylococcus aureus can be spread from person to person throughout direct contact, but TSS is actually a complication of infection and it cannot be spread to others, unlike the bacteria. So for the virulence factors of Staphylococcus aureus, the main one is the structure. It's a microbial surface components recognizing adhesive matrix molecules, or MSCR-AMMS, which promote cell-to-cell attachment and biofilm formation. And of these MSCR-AMMS, it includes staphylococcal protein A, fibronectin binding proteins A and B, collagen binding protein, and clumping factor. So for toxins, we have an alpha toxin and a beta toxin. So the alpha toxin disrupts smooth muscle and blood vessels, and the beta toxin, also known as sphingomyelinase C, degrades sphingomyelin and membranes, and it also lyses erythrocytes in order to evade the host immune system as well as scavenge nutrients. And less than 5% of Staphylococcus aureus strains produce exfoliatins, ETA and ETB, and they are proteases that degrade desmosomes, holding epithelial cells together. Staphylococcus aureus also produces enzymes that help aid in its virulence. So the first being coagulase, it converts fibrinogen to insoluble fibrin, which causes staphylococci to clump together. And if we look over here to the right at the slide coagulase test, we can see the negative coagulase test, there's no clumps, and in the positive coagulase test, we can see a clump of the staphylococci together. The second enzyme being fibrinolysin, also known as staphylokinase, it dissolves fibrin clots. And the last being hyaluronidase. It promotes virulence through breakdown of hyaluronic acid during infection, which it also binds the connective tissue and host tissues. And so if it's breaking down that hyaluronic acid, the connective tissue can't be stuck together and it breaks. So for pathogenesis, we can see that Staphylococcus aureus adheres to damaged skin, mucosa, or tissue surfaces, and at these sites, they evade defense mechanisms of the host. So like I stated earlier, Staphylococcus aureus secretes several virulence factors that evade host human immune defenses. And if we look at this picture, we can see some of those include alpha-hemolysine, phenyl-soluble modulins, or PSMs, and Panton-Valentine leukocidin, or PVL, and they all have the capacity to lyse host cells, which is a mechanism to then evade immune responses, which we can see right here. Staphylococcus aureus also produces diseases by multiplying in tissues, liberating toxins, and stimulating inflammation. So the initial stage of TSS involves colonization of Staphylococcus aureus, and then colonization is followed by a production and release of one or more pyrogenic exotoxins which act as a superantigen. And because of this production of exotoxins, it causes the TSS to become more problematic. So then Staphylococcus aureus produces an additional group of toxins known as toxic shock syndrome toxin 1, or TSST1, and of these TSST1 are fever-inducing or are called pyrogenic toxin superantigens. These then stimulate the proliferation of the T lymphocytes, which then causes the toxic shock syndrome. So there are two types of TSS. You have menstrual associated TSS, which you get from like a high absorbency of tampons, but there is also a non-menstrual TSS, which involves the bacterium Staphylococcus aureus getting in surgical wounds in your lungs, skin and soft tissue infections, and indwelling devices. So for either forms of TSS, the menstrual or non-menstrual, the treatments are pretty similar. You have antibiotics and supportive care, IV fluids, medication to raise blood pressure, dialysis, and equipment to aid breathing. And then the prevention for menstrual toxic shock is using the lowest absorbency tampon needed, changing tampons per the manufacturer's directions, thoroughly washing your menstrual cups, and switching between tampons or menstrual cups and absorbent pads during each menstrual cycle. So over here are actually two pictures of tampon boxes, and it shows an awareness in saying tampons are associated with TSS, and it is a rare but serious disease. And then on this one, this is actually a picture of a box that I took, and it has the recommendation for changing your tampon for every 4 to 8 hours, which would be a good prevention measure for TSS. So I actually want to talk about one of my friends that did have TSS. So her symptoms of menstrual toxic shock syndrome started on October 8th, 2020, and she was then hospitalized on October 10th, 2020. Her initial symptoms before being hospitalized included vomiting, diarrhea, high fever, body aches, loss of consciousness, delirium, and fatigue. When she was hospitalized, she developed the red sunburn-like rash and experienced the peeling of the skin on the palms of her hands. And in this picture, we can see the peeling and the sunburn-like rash on her hands, as well as the redness in her eyes. So because her blood pressure got so dangerously low, she began to experience septic shock. And she actually told me that her ER doctor had a feeling it was toxic shock, but he was then dismissed by all the other doctors and was told that the disease doesn't happen anymore. And it finally took an infectious disease doctor to tell everyone else that it was TSS when the labs came back positive for Staphylococcus aureus. Abby actually acquired menstrual toxic shock from wearing Playtex sport tampons. When she was in the hospital, she received multiple antibiotics along with magnesium supplements, medicine for low blood pressure, oxygen, and lactated ringers. Abby was also on Tylenol to help with her fever, and whenever I asked her how long it took for all of this to get better, the exact time frame of her medication, she told me she couldn't quite remember, but she just said it was a constant drip of fluids and antibiotics. And then the fluid she was receiving caused for fluid to build up around her heart and lungs and caused her to have a right bundle branch block and a heart attack. So this is just a picture of her when she was first in the hospital before all of this happened. She is actually doing okay now. It took, I think she had said, a couple of weeks to get back to normal with all of her stuff and her symptoms, but she's now happy and healthy, and yeah. So this is a list of all the sources that I use, and when speaking with Abby, she actually told me of this resource that she uses and she is a part of. It's called Don't Shock Me, and it basically just spreads awareness, and it shares women's story of TSS, and even though it is a very rare disease, it still happens, and unlike the doctor that told her that it doesn't happen anymore, I think it's very important to know what it is and to spread awareness because this could happen to anyone. So yeah, I hope you guys enjoyed.